Hi, everyone. Gabby here, owner and clinical director of Recovered and Restored Eating Disorder Therapy Center. I am here with the amazing Breanna Potts, and we are going to be talking about EMDR. So, Bree, I'm going to let you take it away. Tell everyone what you do at Recovered and Restored. If you haven't seen Bree's first video, here's a little bit of insight, and we'll go from there.
Yeah, so I'm one of the eating disorder and trauma specialists at Recovered and Restored. And I primarily work with teen girls, young women, but really people of all ages, struggling with eating disorders, body image, trauma, anxiety, depression, self-esteem, all of that.
All the trifecta, all the
all of
things.
it. Yeah, any of the effects.
Some OCD,
PTSD. That's where EMDR comes in.
Yeah.
Yeah, and I'm trained in exposure response prevention therapy, cognitive behavioral therapy, dialectical behavior therapy, and now level 1 EMDR. Yeah, that's me in a nutshell.
Yes. Well,
Yeah.
fun fact, you were actually fully trained in EMDR. I only know this because I was speaking with Lori yesterday. Lori was the amazing trainer who helped Bree get her qualifications. And I was like, oh, this is a level 1 training. And she was like, no, this is a complete training. So you are actually fully trained, my dear, in EMDR. Isn't that cool?
Every day. There we go. Yeah. Yeah.
Yes.
So
I was very impressed and excited.
Yeah. Yeah. So fully trained in EMDR and fully trained. Yeah.
And all the other things, because you're amazing.
Yeah.
Yeah.
And then I mix them all. EMDR is a very specific protocol, which I know I referenced if you've seen the other video. It's just like a 8-phase protocol, but the other ones you could do adherently, but I don't really work to them adherently, kind of just mixing different interventions based on what the person's coming in with and what they would need, and finding a treatment type that fits best to what they're looking for. And
yeah, we really want to meet everyone where they're at, right? It's hard. Recovery's hard.
Yeah. Oh yeah. Recovery's really hard. So worth it, but really hard.
Really hard. Yeah. So tell us about EMDR. Bree is our EMDR expert. So she's going to be teaching me a thing and all of us something today. So tell us.
Yeah. So again, I know I say this every time I talk about EMDR, but it's when you explain it, it feels like you're drinking from a fire hose because it's so much information and there's so much science-y sounding terms. So I'm going to try and make this as digestible as possible, but
perfect.
It stands for eye movement desensitization reprocessing therapy. And it's, like I mentioned, an 8-phase protocol. So we can get into that maybe in another video of all the details that go into it, but it's primarily used to help reprocess traumatic memories. And usually people who have had a traumatic event or distressing life-altering event or multiple events, what happens is material gets stuck. So that's kind of what we reference it, is it gets stuck in your brain that it hasn't gotten fully processed. And what that can look like in your day-to-day is kind of that fight, flight, freeze response getting kicked into high gear and feeling triggered and having these intense emotional reactions and avoidance and dissociation. All of that happens, and that's evidence that there's some things there that your brain is still thinking is happening present day when it really just hasn't fully processed it. So EMDR gets to the root of those memories, and it uses fancy term called bilateral stimulation. So we call that BLS. And that is just various ways to kind of get both sides of your brain stimulated. So this can look like taps across the chest. Some people use buzzers and it'll alternate vibrations left and right hands. This would be left, right, left, right. And then that is kind of mimicking what happens in your REM sleep, so that your brain is in this, your eyes are going back and forth, and it helps your brain get all the material processed. So that was a lot. But that's it in a very short, sweet, simple nutshell.
Yeah. It sounds like it's really transformative in the body and really challenging in the moments for the clients. Yeah.
Oh yeah. It's because it's the memories, but it's also targeting the emotions that come up with it, the body sensations, because our body holds on to trauma. There's the book, The Body Keeps the Score, that talks all about how trauma gets stored in our body. And we kind of one of the phases in the 8 phase is there's a body scan phase. And so that's kind of focusing more on the sensations and kind of processing those and like flushing them out of your system, so to speak.
Yeah.
But yeah, it's really hard, intense work, but it's
Yeah.
so powerful. And like when you do it and when you're in it, you might not realize it in the moment because it's very overwhelming sometimes, but
Yeah.
you do see like these tremendous effects from it, and how like just getting both sides of your brain stimulated and how cool the brain is, and that
Yeah.
when you activate all parts of your brain, how you can process things and they don't get stuck anymore. And like you
Yeah.
don't forget your memories, so to
Right.
speak, but the like intense reactions lessen, or symptoms that you're using decrease, and kind of just helps you just have a more healed way of like going about your life. And yeah.
Yeah. Yeah. That's amazing. So
Yeah.
what made you get trained in EMDR besides that it's really cool?
It is really cool. And I feel like a lot more people are like talking about it. I know it's been
Yeah.
around. I don't know the exact time that it like
Yeah.
came out, but I know it's kind of getting its second wave. A lot of people are talking about it now.
Yeah. For sure.
But
It is.
yeah, and maybe because people are realizing like how effective and cool it is. Just like, oh,
Yeah.
I don't know about this. But I actually did EMDR, not like for a very long time because it was during the pandemic, so like things got shut down. But I personally experienced it, and I personally have struggled with like, I don't know where I feel that in my body. I'm like, I don't know. Like, I don't know what to tell you. But what happened was like, it really, when you really try it and you understand it, like you do get connected to that. And I found it in the couple sessions, the reprocessing sessions I've had, very effective and helpful. And I also just like on a professional side, like I do enjoy working with people who've experienced trauma and are suffering from any of the effects from their traumatic experience. And so that is something that I'm just very interested in my work. And so this is just another tool and another modality to help people heal. And yeah, so that's like personal and professional reasons, like why I was so into it when you brought, because you had mentioned like, hey, there's this awesome training. And so we kind of jumped on it, and I was like, yeah, it was great.
Yeah, I'm so glad. I'm so glad you did it. And like, I think sometimes people just need more than talk therapy. We love talk therapy. Nothing wrong with talking. Therapy is amazing. And when you've experienced, especially a trauma, even if the trauma is your eating disorder, right? Like
Mhm.
sometimes you just need something a little bit more to kind of just re-regulate your system, which is what EMDR can do.
Mhm. Yeah, sometimes the talk therapy like can get you started, like it helps you
Yeah.
relationship, or like get you a little bit more comfortable, or even just in identifying some of the things coming up. But
Yeah.
EMDR sometimes is used as like that to get you over that last hump of what's
Yeah.
keeping you stuck. It just can go a little bit deeper than talk therapy can, because it's a
Yeah.
whole body, like you go internal.
Experience.
Yeah.
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 Totally. I love that. So tell me how EMDR might or totally is helpful in eating disorder recovery.
Yeah. So I know you mentioned like an eating disorder itself is a trauma, can be a trauma. Um, and so also eating disorders can, and I know you know this as well, like they can develop as a result of a traumatic experience.
Totally. Yeah.
And
They
so,
often do.
right. And like not everyone's story, I understand that, and like still 100% valid if you feel like there was nothing, no
Yeah.
traumatic history
Totally.
that like triggered the development of it. But just specifically with EMDR, it looks at those memories, those events, like those experiences you've had prior to like the development of your eating disorder, or even like throughout your eating disorder struggle. And it works to reprocess those memories, using those like fancy things like BLS and kind of
Yeah.
within, and all of the different approaches, and going through all of those phases. And the goal there, and what happens with eating disorders, is that when you process that material, you are less likely to engage with your behaviors, and your symptoms decrease, because you're getting to like the root as to why you're engaging in your eating disorder, and that. So yes, very effective for eating disorders. The person who so Lori, who did the training, she also works with people with struggling with eating disorders, and so she did talk about that in the training, of how effective it is for that population as well.
Yeah, shout out to Lori. Let me give her a quick shout out. I need to find the name of her practice. Do you know what it is?
Oh, something at the Pikes region. I want to say that.
I think it's EMDR Center of the Pikes region. Is it that?
Yes. Yes.
Yes,
That's
yes. She is amazing.
it.
She's not only a trainer, but she is a clinician herself. And as Bree said, she worked with eating disorders. She is a certified eating disorder supervisor as well, which is really impressive. So just so thankful to her.
Yeah.
She's just been wonderful. And I'm really, really glad that, we have you to be able to offer this tool clients, because I think sometimes where people do get stuck is that they've in talk therapy, they've developed the language, they've shared their story, they've been so brave, they've decreased maybe some of the behaviors, and then they get
Yeah.
and it's okay, right? Like recovery is really hard. And as we always say, it's not linear XYZ. But if we can offer this extra tool, why not try it, right? I always say it's like worth a try. If you don't like it, you don't have to do it again.
Yeah. And oftentimes people think like, or they don't know that there is this thing and they're like, how is that related? Or why, like, how is that related to like why I'm still struggling? And so
Yeah.
that's what's so interesting too about EMDR is like things can come up that you might not even realize you've been suppressing or that you didn't even realize were connected to some of the things you're struggling with. And it just does wonders when you, again, as hard as it is, but when you reprocess that, the like amazing effects for how it does with overall healing, like and kind of getting you over that last like stuck point that you might find yourself at.
Yeah, absolutely. And like I just love like how brave people are when they're like, okay, I'll do it. Because like sometimes they don't even know, which hopefully this video will give them some insight of like what it'll look like and things like that. But they don't even know, but they're like, I just don't want to keep doing this anymore. Like they're sick and tired of being sick and tired, and their bravery to try, I think is just so
Yeah.
awesome.
Yeah, it's a very brave thing to do. And like even like if you were to go and seek out EMDR, you're always in control of this session. So like
Yeah.
your therapist guides you through it and runs the protocol, but they do talk with you about like kind of developing what your own stop sign looks like. And so you are in control. If you're like, I've hit my limit today, I need
Yeah.
to stop. You can, and no one's going to force you or like push you past what you can handle that day. And so just kind of putting that out there for people that
Yeah.
might pursue this. It's not this like one shot you go straight through, like that you can take breaks and you can still talk with your therapist and process through what happened, but during the actual protocol, it's not like that back and forth talk therapy. But yeah.
And that's nice to know that they are in control. And in recovery, you are always in charge of your recovery at any stage. And I think, doing and engaging in a trauma treatment, that must feel so empowering. So just, something for people to remember, like you're in the driver's seat. You are the expert on you. And all therapists should kind of follow that. But especially in EMDR, I think that's one thing that I really liked about EMDR when I learned about it was like the client gets to say, stop. It's not just like there's no bulldozing.
Exactly. And that's so important for all people, like to have autonomous
Yeah.
recovery, but with survivors, like trauma survivors, really respecting a stop, a no, or an I'm done, like really letting them know that they are in control and maybe they haven't felt in control of certain things. And so that's like one of the big things with EMDRs. You are, like you said, you're always in control
Always
of
in
like
control.
your treatment, but this specifically, there's a part of the protocol that's specific around like what is your stop sign, how will I know when you want to stop, and some time is spent on that.
That's awesome. So how can EMDR also work maybe with like OCD, anxiety? Because we see like kind of like I said, like the trifecta. Eating disorders do not often come alone. So our clients kind of present with different diagnoses as well. So how can we utilize that for other, symptoms or diagnoses?
Yeah. Well, I know we know that sometimes OCD and eating disorders, like you said, go hand in hand sometimes. They kind of like feed off of each
They're
other.
pals. Yeah, they're pals.
Yeah. So much like with eating disorders, OCD is treated in EMDR kind of as like a current ongoing trauma. And what's reprocessed or what's targeted is the triggers, the feelings, the events surrounding the obsessions that come
Yeah.
up in OCD. That then when the person engages in compulsions, or if they just have the like an obsessive part, but not the compulsions, but basically we're targeting like what's happening that's triggering your obsessions, or what's the distress or the fear surrounding your obsessions, and like what might happen. What are you afraid might happen should those come true?
Yeah.
And that is kind of evident of like that gets stuck, like that's the stuck material.
Totally.
And we know, as with eating disorders as well, is that the more we engage with those thoughts, the more stuck and like kind of sick we
The
stay.
stronger.
But,
Yeah.
which I say that knowing that is so much easier said than done, and it's not a choice to struggle, but that's kind of just how the nature of like these things work. And so EMDR then kind of goes into those memories, those feelings, and reprocess those experiences to help you also tolerate the distress and sitting with that, which then ultimately lessens the intensity you feel to engage with the obsessions through compulsions.
Yeah.
Or to give attention just to the obsessions.
Yeah. Or like the rituals. I feel like with OCD and eating disorders too, sometimes we get really stuck in like our habits, air quote, like our rituals, and like maybe where we're feeling really rigid and like, well, this is what I can do, but this is what I can't do. Or with OCD, doing the same things over and over again because we're fearful that XYZ will happen if we don't. But I think it targets what's under the ritual.
Mm-hmm. And there's even this, it's like one of the last phases of EMDR is this like future template. And that's kind of planning.
Oh.
Yeah, EMDR is like a 3-pronged approach. So it's past, present, future. So you address past stuff while you're remaining in the present. And then you address, hopefully not, but like future issues.
Yeah.
So with OCD, it's kind of thinking about the future. Like, okay, well, if this were to happen, how would you like to handle it? Like, how would you like your future self to handle it? And kind of we process through that and kind of install those beliefs. So super cool stuff. But that's kind of the theme I think people are catching on with is EMDR, as we go into like the events and the memories surrounding something and reprocess that to alleviate symptoms.
That's amazing. That's so cool. It's really just like an amazing modality. And the brain is just so fascinating. It's so cool. Okay. So you've talked so beautifully about EMDR and like some of the phases and some of the things that, like the stopping points and things like that. But what could clients expect in their first session, specifically with you?
Yeah. So first session in EMDR is much like the intake. It's a little bit more memory focused. So your therapist, I'll ask more about like if someone comes in with something and then like I'm listening for themes in beliefs that you have about yourself or a situation. And I might ask you like, when else have you felt like that? Or was there another time that this same experience or this sensation came up? And that's how we kind of develop those memories that we're going to reprocess.
Yeah.
But ultimately, it's just kind of like any other session with like your therapist is just gathering information. Like, I just want to get to know what's going on, what you would like to reprocess, what brought you in. And then, of course, there's lots of explanation. Like I give lots of information about what to even expect about the whole process. A snapshot of what each phase would look like. And then, of course, like if they have questions and taking the time to like give them a minute. You're like, okay, wait, like, so what is this?
What are we doing?
Yeah. So it's really kind of just that history taking and sort of memory formation. I'm kind of keeping a track of like themes coming up to kind of bring up later. But questions, answers, intake, that's what you can expect in the first session.
That's great. That sounds like a great first session. I always joke that like I would love if Bree was my therapist. So I'm like, man, I want to have a first session with Bree. But that sounds awesome. I think one thing too that I really liked about EMDR was that it's really like education focused. So like you're always informed. Like there's a lot of information as well as like a lot of consenting. So I think again, when someone is recovering from a trauma, whether it's their eating disorder itself or a specific event, when you're able to consent it just puts you back kind of in the driver's seat. And I think that does give you that piece of control, as well as the information can just make you feel kind of powerful. Like knowledge is power. And I think that's so good for survivors.
Absolutely. I want people to feel like as informed of the process as a whole, because I knew as a client in this, I had so many questions. I was like, I feel like you're hypnotizing me. Like, is that what you're doing? And
I love that.
I asked those questions because I was like, I need to know what's happening
Yeah.
here. But
Fair enough.
no, we are not hypnotizing you. It can
Just
feel
to clarify.
exactly. It can feel kind of meditative when you're like,
Yeah.
especially like with virtual, like I do a lot of like this ball on the screen and you watch back and forth to stimulate both sides of your brain. So that can feel meditative. Of course, when you're having traumatic material, you're not like feeling calm, but
Sure.
I can see like why people would think that, why I thought that. But
Yeah.
yes, I encourage people, please ask questions like about it, because you have every right to know what is going to be unfolding. And you know, it always goes at your own pace. There's no like timeline on we spend 2 weeks in phase 1 or anything like that. It's totally your own process. So there's no timeline on that.
That's awesome. So what is your favorite thing about doing EMDR with clients?
I do love, and I think this is such a cheesy answer, but I do love the like that full circle, like when they get,
Yeah.
because we do like I have you rate your level of distress after every,
Mhm.
well, a couple times even during reprocessing, but before
Yeah.
we end, and watching that go down for them and the way that they're experiencing that. And especially when you get all this information and you're like, I'm really scared to do this, but then you see it unfold, and like that is so rewarding. And I think that just, I always give like time to like talk about that. Like, how was that? Like, how did you feel through that? But I think like the selfish part of me really loves when people like get that like dumbfounded look on their face. Like, wait, what is EMDR? Like, what did you just say? It's like really funny to explain it. And I sound like a scientist, even though like I'm not, but
You are. You're a social scientist. Yes, you are a social scientist.
but I do love to see people experience their own positive effects from it. But
Yeah.
it's also really funny when people are like,
Huh?
I don't really understand anything.
What did you say?
It sounds really weird. And I'm like, it is weird, but it works.
Yes,
So.
I love that. And we will end today by just sharing a really fun fact about
Really
you.
fun fact. Yeah, well, I know we were talking, so I had a fun fact like that I do like to share, but I love to sing and like paint, like have a very creative side to me. So my
Yes,
whole
yes.
YouTube history is like piano tutorials, like voice lessons, all the things.
I love that.
Yeah, it's really fun. I'm convinced in my next life I'm like the next Beyonce, but not really.
Absolutely.
But like professional singer
Absolutely.
dancer. Yeah.
Yes.
But I also just bought my first house. So that's my like more fun fact, I feel.
So cool. So impressive.
Yeah.
When Brie told me this, she was like, oh, it's like not a big deal. And did this like adorable thing that she does where she tries to make it sound like she didn't do anything amazing. And then I was like, no, this is a big deal. That's so impressive. And you should just feel so proud of yourself.
Thank you. Thank you. I'm so excited. So this year I'm very excited. I'll be getting all the dogs. So
Yes. Oh my
yeah.
gosh, you're gonna like start a rescue and I'm gonna support it on Recovered and Restored.
Yes. We have so many therapy dogs in training. What's a couple more? It's fine.
What's a few more? I'm here for it.
Yeah.
I'm so here for it. Oh, I love that. Well, if anyone wants to learn more about EMDR, please don't hesitate to reach out to me or Bree. You can comment below. You can email us through our website. We have a contact page. Also, there is more information on our website about EMDR therapy. Bree is taking daytime clients currently. And if any evenings open up, we will let you know. But we would love to just share in your journey. We know that it can be so hard, but really, if you're ready to take that step and just, commit to therapy, we would love to work with you. Just a reminder, this is not, unfortunately, a supplement for therapy, but we hope that it was informative and helpful and it encourages you today in some way. So thanks, everyone.
Bye, guys.